Okay.
Okay, hello, my name is Fabrice Manavula. I'll be the nurse today for Miss Acacia, who's here. I have a patient overview. So a patient admitted to the hospital with complaint of trauma in the eye. Patient stated that he was prescribed timolol to reduce pressure in the eye for his glaucoma disease. He wrongfully applied the medication directly into the cornea, and 2 minutes later he felt that his eyes was burning, and later after he was hurting, he was feeling like he was stabbed in the eye. After assessing the patient, findings indicate that the patient did not follow. Patient, sit down. Let me sit. Patient did not follow instruction given by his pharmacist on application of the medication. Therefore, patient teaching on how to use the ophthalmic medication is necessary. So this is what we did with the patient. So we have the timolol and we have our gloves, and we're going to teach the patient how to apply a drop medication in the eye without hurting the cornea, not directly to the cornea. So for the patient teaching here, we say that patient teaching after consulting the patient, and Rochester was pulled out of the Perium powder and was given to the patient as follows. Medication applied to the membran such as the cornea of the eye are absorbed quickly because of the vascularity. Patients usually experience burning sensation during administration of eye drop. It's important to note some medication can cause adverse effects to the vision, such as a steroid, potentially causing dry glaucoma, and plaquenil can cause blindness. So we're going to give all this instruction after doing it with the patient, so she can take it home, so she can use it as guide. Okay. So how you doing, Miss Acacia? How are you? You okay? So we're gonna show you how to use your medicine, okay? Alright? So first, you have to look at the medicine, make sure it's sealed, it's not open. You have to look up the expiration dates of this medicine. It says here it's 2/20/2030, so which is good. And it's a high drop timolol, okay? And here I have my gloves. You need to put on some gloves because you're gonna touch your hair, okay? So I'm gonna put on my gloves. I'm going to put on gloves. And first I have to see if there's any drainage in your eye. I see there's no any drainage, but if there was any drainage, I would like to clean your eye. I would like to clean your eyes from inner to outer. Okay, so from here to there. Don't clean from outer to inner because you're gonna bring some bacteria in. So you wanna clean it from inner to outer. You're doing both eyes. Okay. All right. Is that okay? Good. So let's get to it. So first, when you clean it, make sure it's sterile. And second, you may wanna, kind of roll on your medication like this. We do it for the optic medication as well. You kind of roll it like this so that way it can come back to the room temperature. Okay. And then secondly, you wanna pull your head down up and look kind of down. So this will prevent blinking, okay? So if we do this, it's gonna prevent blinking so that way we don't waste all the medication, understand? And second, what I'm gonna do, I'm gonna open my medication. And I'm going to, so for the purpose of this teaching, we're not gonna apply to you, but we're going just to show. So I'm going to make sure that I put my medication 1.5 inch from your conjunctival sac, okay? And when I put it like that, what I'm gonna do, I'm gonna make sure the tips of this medication doesn't touch your eye. So we have to keep it sterile, okay? Okay, and then I'm going to pull out the conjunctival sac, which is the lower lid, I'm gonna just pinch a little bit and then pull down. That's where the medication is supposed to go. So don't apply directly in the cornea, but apply it in the conjunctival sac, which is the lower lid, of your eye. So I'm going to pull it down and I'm going to administer my medication in there. Okay? And then afterward, you have to gently close your eyes. So gently just close your eyes. And if there was some drainage, I have to provide for tissue to kind of clear up. And for, especially for this medication, the timolol, what we do is we're going to press our hand to the nasolacrimal duct. So this will prevent systemic effect. Okay? Because timolol, like I said, is a beta blocker. It's gonna diminish pressure in the eye. So we have to press here so that way we don't have to, the patient have to experience systemic effect. My patient doesn't like me. Okay? So that's what we're supposed to do. So that's how you use the ophthalmic medication, so the eye drop medication. So don't apply directly in your cornea. That's why it was hurting. You have to apply in your conjunctival sac. Okay? Are you sure you can be doing that? Okay? Sure? All right. So we teach the patient to clean the eyes to the inner to the outer corners. Sterility, so they put on some gloves and clean with the warm moistened cloth and upper extension to the neck. So put the neck a little back and look up. Put the medication in 1 inch, 1.5 above the conjunctival sac, lower lid, and drop the drop as recommended. Specific for timolol, you need to apply slight pressure of the nasolacrimal duct for 30 to 60 seconds to avoid the systemic effect. So this was our teaching project for this patient. Thank you and see you later. Bye.